as per your wish. Over to you.
Sometimes the
Namaste and greetings. I, Tanu Palewal, researcher at IMPRI, Impact and Policy Research Institute, Prabhav एवं नीति अनुसंधान संस्थान, नई दिल्ली, extend my warmest welcome to you all to IMPRI Web Policy Talk. We are gathered today for a panel discussion on Population, Health and Union Budget 2024-25. This deliberation is a part of IMPRI 5th annual series of thematic deliberations and analysis of Union Budget 2024 and 25, which is a series of panel discussions on crucial key policy issues and Union Budget 2024 and 25 involving more than 100 thematic distinguished experts and research team members. This discussion is organized by the Center for Human Dignity and Development, IMPRI Web Policy Talk. Our chair for the session is Dr. Manorama Bakshi ji, Director and Head of Healthcare and Advocacy, Consortia Advisory, Founder and Director, Trilok Raj Foundation, Visiting Senior Fellow, IMPRI. We welcome you, ma'am.
thank you.
So, today's deliberation comprises of an excellent panel of experts who will be sharing their expertise, which includes Professor Sanghmitra Sheel Acharya ji, Professor, Center of Social Medicine and Community Health, Jawaharlal Nehru University, JNU, New Delhi, Mr. Abhijit Mukhopadhyay ji, Consulting Economist, the Secretariat, Ms. Urvashi Prasad ji, Director, Office of Vice Chairman, Niti Aayog, Dr. Shoba Suri ji, Senior Fellow, Health Initiative Observer Research Foundation, ORF, New Delhi, Professor Pradeep K. Panda ji, Professor and Dean, School of Public Health, Asian Institute of Public Health, AIPH University, Bhubaneswar. We are extremely grateful to have a distinguished panel of experts joining us today. Proceeding further, I welcome all the participants to this enlightening deliberation and thank you for being interested and putting your time, energy, and efforts into understanding the nuances of gender and social inclusion within the union budget while helping us to bring together the practitioners and participants through this discussion. Now, without any further delay, let us start with our program. It is my honor and my privilege to invite Dr. Manorama Bakshi ji to start the program with the chair's opening remarks and proceed with the panel discussion. Over to you, ma'am.
Thank you so much, IMPRI, as well as Tanu, for this wonderful introduction. And to begin with, on behalf of IMPRI, it's definitely an honor to chair this session, especially with the esteemed, esteemed people, esteemed professionals and key people who have worked in the healthcare industry and healthcare domain. In this presentation, we will look into the budget allocations earmarked to the healthcare ministry. As you all know, the healthcare department or healthcare ministry is divided into Department of Health and Family Welfare and Department of Health Research. Out of the budget allocated to the health ministry, 90,958.63 crores, 87,656.9 crore has been allocated to Department of Health and Family Welfare. And of these, 3,301.73 crore has been allocated to Department of Health Research. We then our almost like 12.93% increase over the previous year. The critical question for us all healthcare professionals remains, is this allocation sufficient enough to address the critical pillar of the Viksit Bharat, that is the healthcare? The finance minister also announced customs duty exemption on the X-ray tubes, flat panel detectors for medical X-ray, indirectly like promoting the domestic manufacturing of these machines, especially what is the PM vision of Make in India. To improve the affordability of cancer care treatment, the finance minister has also exempted 3 cancer drugs from the customs duties. The budget expenditure for financial year 24-25, when it comes to the NHM, has increased almost 4,000 crores from 31,500 crore to 36,000 crores. One more additional thing, which was well taken by all the public health professionals, was the vaccination program, HPV vaccination, which was introduced to 9 to 14 girls. It is seen as a proactive measure of the government towards the early intervention and reducing the mortality due to cervical disease. Extension of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana to Asha workers, Anganwadi workers, community mobilizers is another commendable step that we all appreciate. However, the anticipated extension of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which we all felt that should be extended to elderly people, has not been materialized. This session will delve into the allocations and policy directives that are laid in 24-25 budget. We will explore measures aligning to national health priorities, such as strengthening the primary healthcare systems, enhancing the health surveillance, disease surveillance, expanding the health insurance coverage, ensuring equitable access to the health service across the demographics. Additionally, we will also discuss like lot has been done in the pharma domain, but however, medical device industry, still we are bereft on that front. We just have 20% of in medical devices. So we would like to talk also about that. We would like to also discuss about medical value travel and One Health, which has been going on for quite a long time. We have been talking on those issues. Furthermore, this health budget, we will also address social determinants of health that includes the nutrition, education, and other aspects. Our goal today is not only to critique, but to constructively evaluate the budget's potential to transform health sector. We aim to identify gaps, suggest improvements, and advocate for policies that will lead sustainable health outcomes for all of us for the larger good. I encourage all the panelists to actively participate in the discussions through their insights and recommendations. First of all, I will ask Professor Panda for his opening his speech with a question like, what is the major takeaway from the budget, health budget 24-25 overall? And how does he see the assessment of the health budget? Is there any kind of, correspondence, what was allocated and what has actually been spent? What are the major announcements that he has seen the budget is relevant to the public health? Professor Panda is Professor and Dean of which Tanu has already shared with all, Dean of the School of Public Health. Over to you, Professor Panda.
Thank you very much, Chairperson Ji. First of all, I'm grateful to IMPRI for this opportunity, and a very good afternoon to all the participants and my fellow panelists. So let me begin with what are the major takeaway from the overall budget. So as you know, the post-election budget for 2024-25 deserves credit for aggressive fiscal consolidation to create fiscal space for future shocks like COVID-19. The government has lowered its fiscal deficit target for fiscal year 2025 to 4.9% of GDP, down from 5.1% target set in the interim budget. The fiscal deficit will be reduced further to 4.5% or less by fiscal year 2026. So this is crucial for maintaining fiscal discipline, ensuring macroeconomic stability, and attracting foreign investment. Second, the allocation of resources between growth-enhancing capital expenditure and welfare-enhancing revenue expenditure appears fair and just in the context of current political economy. Third, the government has come out with several employment and skill development schemes that will address the problem of jobs. For example, targeting 4.1 crore youth with a central outlay of 2 trillion rupees over 5 years. This includes various schemes like employment link scheme, support to first-time employees, incentives for manufacturing job creation, and support to employers. In addition, a new centrally sponsored scheme for skilling is expected to benefit 20 lakh youth over the next 5 years. Having said this, let me now focus on a few disappointments, according to me. Gray area. 2. I could highlight. The first one is that this budget is a big letdown in terms of structural reforms, which will hamper long-term growth. Second, providing disproportionate resources to Bihar and Andhra Pradesh is injustice against several deserving states and may weaken cooperative federalism. So these are my two disappointments. Let me now move to the health sector. That is the focus of today's discussion. Allocation of funds for education and health is disappointing. Allocation to health sector in central government budget in 2024-25 is 90,958 crore rupees, as the chairperson has told and shown the data to us. So there has been a 12.9% increase from 2023-24 revised estimate to 2024-25 budget estimate. Allocation to health sector in central government budget in 2024-25 is just 0.28% of GDP as compared to 0.27% of GDP last year, 2023-24. Hardly there is any increase. It is almost constant at 0.28% of GDP. One would have liked to see the allocation to health sector to reach 0.5% of GDP and gradually rise to 1% of GDP in future. Since high out-of-pocket expenditure and shortage of human resources for health continue to be major issues in India, it is absolutely essential to enhance health budget. The current budget is not sufficient. The past trend suggests that the amount spent in health sector is invariably less than what was allocated in the budget. So I can tell you a few statistics. For example, it will be known from the past trend if you compare 2023-24 budget estimate with 2023-24 revised estimate. When the budget allocation is done, it is more, but spending is less. There is a huge discrepancy, and I'll tell about some of the important schemes. Let us start with PMABHIM, that is Prime Minister's Ayushman Bharat Health Infrastructure Mission. As you know, this is a very good scheme because it focuses on primary healthcare infrastructure, which is so important for a country like India. If you compare the budget estimate, that is 4,200 was allocated in 2023-24. How much was spent? Almost half of it, 2,102. So although allocation was more, spending was only 50%. Come to another important scheme, PMSSY, that is Prime Minister's Swasthya Suraksha Yojana. As you know, it focuses on establishment of new AIIMS and upgrading of government medical colleges. So if you see the budget estimate 2023-24, it was 3,365. How much was spent? Again, less than half, or about 45%. 1,900 was spent, revised estimate. Okay, let us come to PMJ, Prime Minister Jan Arogya Yojana. Relatively better, although less is spent. The budget estimate is 2023-24 was 7,200 crore, but how much was spent? 6,800 crore. Much better, but still less. Another program, National AIDS and STD Control Program. What was the budget estimate last year? 3,080 crores. How much was spent? Again, less, 2,421 crores. So always there is a mismatch between what is allocated and what is being spent. So that is another thing. So what are the reasons? This could be due to several factors, including administrative inefficiencies and health systems weaknesses in absorptive capacity. Then one would have hoped that the government will pay attention to greater utilization. So we expect that given the past trend, the government will focus more on utilization, here onwards. Whatever is allocated, at least utilize the money well. So that is one aspect. Then two major announcements for the health sector. Already the chairperson had told, just I'll be little bit elaborate. So 3 cancer treatment drugs are exempted from basic customs duty completely from 10% to nil to help patients with cancer. So cancer treatment involves a significant financial burden. So by exempting these drugs from customs duty, the government has taken a concrete step towards alleviating the burden, making essential medications more affordable and accessible for those in need across the country. This decision also underscores the government's commitment to addressing the growing cancer burden in India, emphasizing the government's dedication to improving public health. So this is a good thing which has happened. Second, already chairperson told, and you know, proposed changes in the basic customs duty for X-ray tubes and flat panel detectors for use in X-ray machines under the phased manufacturing program to synchronize them to domestic capacity addition. This will significantly benefit OEM manufacturers by reducing cost, encouraging local sourcing, and enhancing competitiveness. This will also incentivize healthcare startups to foster innovation and self-reliance. Another announcement may benefit the health sector startups is the abolition of angel tax. Abolition of angel tax and tax simplification, which are expected to enhance financial help for businesses, including healthcare startups. So I could see only few of these major announcements in the health sector. So I'll stop here and we'll discuss later. Thank you so much.
Thank you so much, sir. Tanu, are we supposed to talk a bit following this discussion, or we will have the another panelist? I feel that Dr. Panda, you have raised some of the very pertinent issues, and you have addressed, like, you spoke about the this Make in India, wherein you spoke about the angel tax. Definitely angel tax, since now we are sort of envisaging that government is envisaging that we will do the same kind of success story when it comes to the medical devices. And for that, like, we have already established medical, parks in the Telangana, even though like not many people are now have taken up the lands there, but not many, manufacturers have started there. So I think that India is going to, or envisaging that we will have good manufacturing hubs around, especially in medical devices. So that's one good thing. You also laid a lot of emphasis about the, overall, like the initiatives that government envisages or has already taken up. Along with we spoke about the cancer care, but I think along with cancer care, one needs to be very sensitive about the NCDs, diabetes, and look at the latest IHP 2021, we see that COPD, CHD,
Yes.
CKD, and these are some of the issues that we have to think about looking at, because it's like a volcano. We're sitting on a volcano, and NCD is something that we have to actually address. And it is not being addressed, even though we have put in some funds here and there on cancer care, but it is not addressed in the way it should be addressed. And it is spreading its tentacles, even though like the NHM budget, when it comes to the maternal and child mortality. But when looking at the mortality from this, say, the NCD, I think that that also needs to be addressed in a very bigger way. Saying so, I am moving over now to Dr. Shoba Suri, Senior Fellow, Health Initiative Observer Research Foundation. Madam, I would like you to throw some kind of, light on the health budget translating into the improvements when it comes to the women, child, and nutrition health at grassroots level. Also, I would like to know a bit on the service delivery. How is the OPEX, or how is the health sector sort of shaping up, and what it means to women going to, public health hospitals, what it means having their complete 4 ANC, which is still we are grappling with, like women not having their proper 4 ANCs at least, like. So what it means, like how we can address the anemia. So over to you, ma'am.
Yeah, thank you, Manorama ji, and I'm thankful to IMPRI for inviting me for this important discussion. A lot of context has been already set by you and Dr. Panda. It makes easy for me to, talk about the synergies between how the health could impact the women and children health and as well as nutrition. But I will just like to set a few context. When we talk about this budget, talked about the Viksit Bharat, where it talked about how it aimed at economic growth, social welfare, and sustainable development. And a very important aspect when we talk about social welfare is health and nutrition. And the budget has both plus and minuses, which has been very well elicited by Dr. Panda. So in broadly, if I want to say about the health budget is, I would say that the allocation has been way below the health needs. And that could be also seen by though the increased focus on health is there, but if you see the overall budget to the health sector has kind of remained stable over the years. Like, it's around 2%, to be precise, it's around 1.8%, which is pretty low. And even the WHO recommends that the government should allocate at least 5% of the gross national income to their healthcare budget. I mean, this guideline is keeping into view the understanding that a sufficient and a sustainable healthcare budget is important not only for ensuring good health as well as well-being. And when we talk about SDGs, I think that is a priority when we look at how healthcare could be improved to be able to achieve at least some of the indicators of the 2030 Sustainable Development Goal agenda. And I feel that yes, the allocation of the budget estimates now to the previous ones, some of the programs and some of the health resources kind of remain the same, or they have come down, except for Ayushman Bharat, which has got a little extra on in terms of the line items. But when we look at programs like the human resources for health and medical education, which is a very important component, I mean, that has seen a decrease from the previous budget estimate of 2023-24. And the revised budget being less does not mean that the program is utilizing it. It actually means that they have not utilized the funds and the program requires more. I mean, Dr. Panda put it very rightly that the funds have not been utilized. That is a big lacune or a challenge. And even if you look at the National Digital Health Mission, we are talking so much about technology, but the budget allocation, the estimate remains the same as the previous year. Overall, they have shown an increase of around 12.9%, but it still overlooks the obesity epidemic. It also overlooks the NCDs, the rise in NCDs, as well as the mental health challenges. I think it's very critical since post-COVID to kind of give a emphasis on the mental health, which is very important and a growing concern. Briefly, if I talk about the nutrition, the Ministry of WCD has seen a minimum rise of about 2.5% in the allocation from the previous year. Especially to look at programs like the Saksham Anganwadi or the Poshan 2.0, which are the main programs for combating malnutrition and to supporting early childhood care, have been given 21,200 crores, which is kind of a decrease from the previous budget. We are already facing the challenge of malnutrition. We are the highest in terms of Asia and in South Asia. So I think this program needs to be given its due emphasis. Even other programs like the Mission Vatsalya, which talks about child protection, or Mission Shakti, which basically talks about the women empowerment and the schemes like providing support to women, like the Pradhan Mantri Matritva Vandana Yojana, which is like a conditional cash transfer. All that has been reduced from the budget estimate from the previous year. So, food subsidy, there's not much of mention despite the growing population. There's nothing on the supplementary nutrition program, which is so essential, or the midday meal, or even a basic need of an honorarium increase for the Anganwadi workers. Like, it's been stagnant for years. But yes, some improvements, not all is bad. Like, when the finance minister talk about the Garib, the Mahilayen, the Yuva, and the Annadata, yes, a lot has been done in terms of youth and skilling and entrepreneurship. When it comes to the Garib, they have extended the Garib PM, Garib Kalyan Yojana for another extended years post-COVID. Mahilayen, there's been a lot of women-led development, but I would still debate whether it's an actual increase or it is a kind of a reallocation within the schemes. I mean, that is something which needs to be seen. One good thing which has happened in the priority areas is agriculture. I think agriculture has really been given an important space in the 9 priority areas as highlighted in the union budget. But yeah, certain things still need to be done. It's not all perfect. There has to be a lot of challenges which needs to be overcome to be able to actually implement certain of these changes which have been highlighted as a raised budget in the union budget. Coming specifically to the synergies, when we talk about how these improvements or the health budget can be translated into women's, child, and nutrition health, I think there's a need to prioritize more on programs, specific programs which is aimed at maternal and child health. Very rightly you said, including the antenatal care program, the immunization, as well as the nutritional support. But along with that, I think there is a need for enhancing the infrastructure and the human resource development. We need to build on the primary health centers, especially in the rural areas or in the margin or for the marginalized communities, where the accessibility and availability is a very important issue. We require trained manpower, trained healthcare professionals, trained community health workers to be able to provide that adequate care and support. And I think the skill needs to be again and again rebuilt. It's not that once they are trained, they continue the efforts. More key factors also include resource utilization and robust implementation and monitoring of the programs. I think it's very important once the program sets in, we need to see whether it's working in the right direction or what changes need to be done from time again. Not that the program is working, if it is going down, I mean, we need to see how it can go upscale, how it can be implemented better. And more so also required is a program for the behavioral change, which, like, especially for the health seeking behaviors among women and children. When we talk about anemia, I think it's a matter of concern, and how behavior change, communication, and the awareness can bring about a change in the community. That's very important. I think effort need to be made in that, and also investments. So that would a kind of an allocation which needs to be there in the budget. Plus, public-private partnership, more investments could actually go in the long run. And finally, I would like to say that even social determinants like sanitation and economic empowerment, they are also required to support the health outcomes. I mean, they all go hand in hand. You cannot talk about them in silos. And when we do certain factors from this, we can expect some benefits, including reduced maternal and child mortality, improved nutritional status, and also increased health awareness among the communities. So I think these are some synergies which could be actually work for the health as well as the nutrition sector. And we would also touching upon some of the SDGs on 1, 2, and 3, where they go hand in hand. And to touch upon the operational expenses which you talked about, I think the one and more major important thing is human resources. I think it's very important to have trained and skilled human resources if we really want to prioritize and enhance the service delivery for women and children, and even for the community or for the population as a whole. And also, this has been prioritized under the Viksit Bharat, priority schemes. Yes, medical supplies and essential medication, that is also very important if we want to look at efficient service delivery. Some aspects have been included, but I think more needs to be done uh, for the country. Another important aspect is the infrastructure and the maintenance, because we need to have better infrastructure, better primary care facilities in order to be able to deliver better or give better services to the community. Digital technologies, I think DPIs and climate resilient crop varieties have been talked about in this budget, but I think more needs to be done to be able to tech enable the whole community to serve better. And finally, I would like to say that these investments not only strengthen will not only strengthen the service delivery, but they will also improve the health outcomes for women and children on the whole. So I'll stop here. If there's something else, I'll come back later.
Thank you so much. Thanks, Shobaji. You have actually opened the Pandora's box completely when it comes to the, healthcare delivery systems, women, children, nutrition, under the overarching Viksit Bharat that we envisage. And you have addressed most of the issues. You have addressed like right from the woman gets pregnant to the baby is born. You have addressed most of the RMN issues that government has already initiated, but some of lot needs to be done on those front. And I think that definitely the government has been sort of, when it comes to the programs, but we have the multiple programs looking into, right from JSY, JSSK, Anemia Mukta Bharat to Matritva Vandana Yojana, but these are multiple things. I think if we can have our arching now one scheme that caters and looks into all these aspects, I think that can be more this thing. And then the synergies between, now WCD is looking into Matritva Vandana Yojana, but JSK, JSY and other things, ANCs are looking into health, Ministry of Health and Family Welfare. If we can have synergies and, good sort of like support between these departments at the grassroots level, probably like when these small children, babies go to Anganwadi centers, and those babies are well taken care of, the adults and girls are well monitored about the anemia and those kind of things. I think that needs to be captured in a very big way at the grassroots levels. But definitely you have touched most of the priority issues. Now I'll be going further with Mr. Abhijit Mukhopadhyay ji. He is the consulting economist, and I would like him to throw a bit of light, like increase allocation. As just now, Madam Shoba said that even though there has been increase, but the increase is not enough. Like it by numbers, we can say that it's almost 13% increase. I would like to know from you, sir, like what is when we talk about the job creation or economic growth, especially like when we are saying that internship and skilling, will those kind of internships and skilling lead us to some kind of job creation in health segment? Because health segment is something wherein almost 5 lakh jobs are every year added to the cohort of health sector. We have already like approximately like 10 lakh ashas are there. Then we have the ANMs, we have the community mobilizers and Anganwadi workers. But then the question is that is not enough. Looking at asha, one asha capturing care of 1,000 people in a village, and sometimes the village there are only 100 or few hundred people in that village, and the asha has to travel 10 kilometers. I think we need to look into those kind of aspects also, like maybe enhance or maybe increase the human resources so that they can cater to the like our most populous country. So I would also like to listen to you, Mr. Mukhopadhyay, talking about the capital investment in healthcare, like, and over to you, Mr. Mukhopadhyay. मिस्टर अभिजीत जी हैं क्या यहाँ पे?
Yeah, just let me unmute myself. Yeah. Yeah, fine. I have something around 8-10 minutes, I think. Is it?
Yeah,
so?
you please continue, sir. That's
Yeah,
not.
yeah. So anyway, I just saw your, the questions that you have put in mail. But anyway, first let us do the customary things first, and then thanks a lot to IMPRI and particularly to Arjun, who is otherwise also in touch, over WhatsApp. Of course, not in physical touch, but now probably I'm coming fourth or fifth time in these panels, and I also enjoy. I was hoping to see Devender also, but anyway, doesn't matter. It is good to see you, Professor Panda and particularly Shoba. I'm seeing her after a little bit point of time, but then it's very nice to see her, and share the same panel. But anyway, let me start very, to the point. I'll come to the questions that you asked later, because employment, I think that the topic we are discussing is more related to health, population, and those kind of things.
Sure,
But
sir.
I'll try, since you asked, then I'll try to very briefly in the end to, I got the essence of your question, but then anyway, let me first speak out. Then possibly, some part of it will become very clear. Not a very good year to discuss health budget. As very correctly pointed out by Shoba and also Professor Panda. They have given some figures, but before I go to those figures, then because I just saw your question and you said that there is a 13% increase, but actually it is not 13% increase, because if we calculate the percentage increase over revised estimate of 23-24 with the budget estimate of 24-25, then it is 12.7%. But a more apt kind of comparison would be to compare the budget estimate of 23-24 with 24-25. So that is actually 0. I just calculated that it is 0.37, let's say 0.4%, but even less than 1%. That is what I am trying to say. And not only that, in the less budget is getting allocated, and so it actually means that actual spendings are much less than whatever is allocated in the budget, which is a problematic thing. I think last year also some people pointed out. I think my junior and very good friend and my ex-colleague also, women pointed out, if I remember correctly, last year that there have been consistently, there have been funds are getting unspent and then sent back. Generally, funds are, in essence, those funds are getting wasted. So it's not a very happy situation when we don't have enough funds, and then whatever funds are given, those are not utilized properly. So that is point A. That is actually something which needs to be looked into. I'll come into the other details of it later. But first of all, I would say that one lady yesterday or the day before, I was watching one lady in one of those organizations. She was arguing for a the inter-spending, the budget impact assessment kind of a thing. Then she was possibly, I am not sure whether she was talking in general or in health only. But then in some of the sectors, I think in the social sector and the health education, these kind of things, I think it may be a good idea. If everything, yes, I know there is an outcome budget which actually points down whatever is been done in the last 1 year. But last 2 years, I am going through that. It is not very, forget about comprehensive, it is actually not very legible also. Why I am saying so? Because suppose, there are, the target is set like, there are 5 projects in certain funding or something like that. And when the outcome side, I'm coming to the right-hand side, the outcome side, it is actually saying that, some 30 hours, or, sorry, let's say some 350 hours of 350 man hours have been created or something like that. So I can't compare all these. So proper impact assessment possibly is a I think a kind of I would say one step that can be done, in general. I am not saying that not only in health, but wherever it is possible. I know it is very difficult to implement it everywhere, in each and every ministry, each and every department. It will not be able, the government is not in a position. So that I understand. But particularly in health, it may be a good idea. And then in a related point, I would say that if we look at, forget about, I'll come to that, that entire as a percentage of GDP thing, I'll come to that. But before that, let me even talk about the health budget allocation, as a percentage of the total budget. When actually you take the total budget expenditure and you take the ratio of health budget allocation in that, this was, almost 2.3%. I think in 2019 and 20, not, oh, what is this happening? Okay, yeah. Sorry, some Zoom notification came. Now, that it was 2.3% of total budget in 2019 and 20. But now it has, even during the pandemic years, the peak pandemic years of 2021, 21, 22, it was below. It was below 2.2% and 2.1%, I think, most probably, respectively in these 2 years. So, but yes, I understand in those 2 years, a lot of other kind of funds, from all other different kind of ministries have been mobilized whenever, some emergency arrived. So of course, the Ministry of Industry, some fund has been given and then put in into the oxygen plant, and all those things happened. I'm aware of that. But then the point is that but where are we now? At 24, 25, once again, we are at 1.9%. And not only that, very surprisingly, when I was just watching the interim budget allocation was slightly, very marginally, but slightly higher than the, this full budget allocation. So I think, of course, the entire issue of generating employment, particularly in the rural sector and the MSMEs, those in fact eclipsed all kinds of concerns about some other sectors. Health is one of them. So that is what has actually happened. And I am not getting into this because Shoba very nicely have put in all the, the details of the projects. But one point I would definitely like to make is that, as she also pointed out, but in most of the health schemes, and even in Swachh Bharat, Swachh Bharat is not a very hardcore kind of a health scheme, but still, if we consider the hygiene and other kind of, and it's a flagship scheme. So it remained the same. Either it remained the same or it has gone down. Even for example, what I am trying to say is that Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, so that there has been 1,000 crore less allocation in that. The only place where, in fact, allocation has substantially increased, the only one scheme, that is what I could found out, that flexible pool for RCH, basically reproductive and child health, and the entire health system strengthening and national health program and so on. Those kind of, it's a umbrella kind of a fund where actually 30% more fund have been put, which is good. I'm not saying it is bad, which is in healthy, but I don't know whether it will go into the health infrastructure or whether it will get into the reproductive and child health. So any other major flagship scheme, they didn't get much, they didn't get much, or the increases are not that much. So that is number one. And secondly, what I feel is that, for example, what I was trying to figure out is that in that Ayushman Bharat, health infrastructure thing, or even if we look at, the entire insurance wala scheme, that entire Ayushman Bharat, PMJAY, Jan Arogya Yojana thing, the allocations have not increased much, only 100 crore or something like that. If you adjust with inflation, then actually it has gone down in real terms. So my point is very simple. My point is that if one particular or one or more particular flagship programs are not working, and government does not feel the urge to, spend more on that, then let's say so, So that is why in the very beginning, I started by saying that there should be an impact assessment. If the impact is minimal or impact is negligible, you just, completely dismantle that scheme. Come up with some new scheme. How does it matter? There is no, nothing wrong in admitting that, something is not working and we need to put up a new kind of a scheme or new kind of a mechanism. So that is another way of, I think, putting it. I will, before concluding, because I'll just touch the entire population point also. Population point is that the recent Institute for Human Development report, in fact, it has projected by 2036. It is almost there. We are almost there. Within 10, 12 years, we'll be there. So there will be the 60 plus population, 60 years, more than 60 years old population will be 15% of the total. So if that is the kind of situation we are getting, and not only that, even I was looking at some UN Population Fund report. This year on maybe, it was the end of September, October last year it came out, if I can remember correctly. So it has projected by 2050, India's population will be somewhere around 20.8 or close to 21%, that entire 60-year plus, the entire senior citizen, basically what we call commonly as senior citizen. So that means, if that becomes 20% or 21%, let us say 20%, let us say 20%, and we have within the working population, we have somewhere around 15 to 59, that will be somewhere around 64%. But 20 or 21% is also a very big number. And there is a problem here. Problem means that recently, I think IRDAI actually came up with this notification, which is a good thing. I would obviously have to say that, which is a good thing, that there is no more ceiling, ceiling for the health insurance scheme. So earlier it was set at 65 years of age. Beyond that, nobody can take health insurance. Now they have changed the rule, but how all these private insurance companies react to that, whether they will actually implement it or not, we don't know. And 20% is a lot, because 1/5 of your population in another 20, 25 years will be absolutely old and they will be uncovered. In a way, they will be uncovered. So possibly there is a need to give some kind of a free healthcare. Ideally speaking, I would demand, if I am a policy lobbyist, or, I am lobbying for some kind of a health policy, then I would definitely, this will be in my agenda. I would say that, that these people should be, at one point of time, they should be given free healthcare. Not health insurance, they should be given free healthcare. I have my own problems with health insurance, entire, the model itself, but I will not go there. But if we have to do that, we need health infrastructure also. But those things are not forthcoming. And I would say that it's a little bit problematic, because I will just, before just, the finally concluding thing, I will just give you that some of the figures, because, that forget about, other places. Let's say China, South Africa, and Brazil. In 2021, they spent 5.4%, 8.3%, and 9.9% on health, of GDP on their health. And how much India spent? India spent, I think, somewhere around, we are 4.3% or something like that. So we started that. Sorry. In 3.3%. Sorry, in 2020 and 2021, in both those years, we are spending 3.3% of our GDP. So that sums up the entire thing. We need to, raise this percentage actually is very important, because otherwise, once your GDP increases, your people are also increasing. Hopefully the population will happen. Some unconfirmed reports are saying that next year the population census will be undertaken. So once that happens, then I think if a detailed census is undertaken by the government, then of course, we'll get a much, much clearer picture. But nevertheless, whatever may be the case, the allocations should go up. This is not a very, we have seen that in the pandemic. It's a kind of a repetitive thing and a cliched thing I say every year in this panel, but every year I start from there. Let me just, end my, first intervention here, that by saying that, if pandemic actually, taught us any lesson, then it will be to spend enough money on health infrastructure. Otherwise, we may be in trouble in future. Thank you.
Thank you so much, Abhijit ji. Thank you. You touched some very important points, especially in 2017. We had mentioned, and health policy of the government had mentioned that at least 2.5% of the GDP the country needs to spend on the healthcare, public healthcare. But somehow, like, that has not, we have not been able to achieve that yet. You touched something very important, where you touched about the free healthcare for the elderly. And I think that's very important, especially when we have the Ayushman Mandirs, what we call now them, health and wellness centers have been named as Ayushman Mandirs. I think on that aspect, I would like to say that there also, like, the OPDs are not covered, the medicines are not covered. So I think that we need to have some kind of, connection between the Ayushman Bharat Yojana and the Ayushman Mandirs, so that whosoever goes there, at least the primary health care, they are being given free OPDs, free medicines, that at least at the primary health care level, that can be looked into. And you spoke about the inflation and looking at the minuscule increase or the incremental increase, that is almost negligible. Well taken, sir. Now, we have Sanghmitra ji's video. So I request the IMPRI team to, that's almost a 10-minute video, Sanghmitra ji. So she has actually shared that 10-minute video with the IMPRI team. I request IMPRI team to play that video.
Thank you, IMPRI, for giving me this opportunity to be part of this panel today. I think it's important to discuss about how the union budget has posed itself for the social sector. To begin with, what the Union Finance Minister presented in the form of union budget for the financial year 2024, the total expenditure estimated was at something to the tune of 48,20,512 crores to be precise. And the focus, as the budget says, will be on growth and development in the country. I'm sure all budget aim to do that. This particular budget envisages sustained efforts on 9 priority areas. To begin with, productivity and resilience in agriculture, employment and skilling, inclusive human resource development and social justice, manufacturing and services, urban development, energy securities, infrastructure, innovation, R&D, and next generation reforms. In fact, in her speech, the finance minister highlighted 4 focus points, 4 focus areas, which were poor, youth, farmer, and women. What is also important to notice that there were announcements regarding some significant allocation for centrally sponsored schemes such as Mahatma Gandhi National Rural Employment Guarantee Scheme, Pradhan Mantri Awas Yojana, Jal Jeevan Mission, and also the potential, change that the tax slabs could be proposing with the intention to help the taxpayers with a net gain of around rupees 17,500 a year. The government also allocated funds for social sector, which includes health and education. Health has an allocation of something to the tune of 89,000, and education something to the tune of 1,35,638 crores. Rural development, of course, has more than both of these sectors, which is something to the tune of 2,65,808 crores, to be precise, as we quote from the budgetary documents. While the expenditure on social sector seems to be resting somewhere close to 1 to 2 lakhs, 2 lakh and some thousand crores. When we look at the expenditure on defense, the allocation is almost to the tune of 4,54,770 crores. Subsidies on food, fertilizer, and petroleum are estimated to be something to the tune of 3,81,175 crores. Therefore, perhaps the point to ponder here is the comparatively lesser allocations on the social sector as compared to the defense and the subsidies. Not that these sectors are not important, but the continuous lesser allocations that we've had in the social sector once again remains at that level of lesser than, there's not much change that we're seeing it. Something, like I said earlier also, with this budget, 2024-25 financial year budget, there was an expectation that something major would be announced for healthcare sector, but nothing very, very considerably significant was made. Perhaps what can be treated as significant was the proposed exemption for 3 major cancer drugs from the basic custom duties, and also the exemption of custom duties on the components of X-ray tubes and digital detectors. So when we look at the total union budget's allocation to the health sector, the whole of health sector, something resting somewhere close to 90,000 crores. If we disaggregate that, we see that the government has allocated 87,656 crores to the Health and Family Welfare Department, while 3,300 odd to the health research department, or sector rather. Therefore, I think the realm of research, the realm of relevance, importance on research is pegged at a place where perhaps, especially when we've just reeled from the health emergencies in the recent past, needs to be taken in the considerations which probably allude to the requirements which are more than what has been allocated. Especially when we look at the center's flagship schemes like Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, or perhaps something which is, if you look at these two schemes, the allocations has seem to have improved from 6,800 crores to 7,300 crores. However, there is no increase in the budget allocation for the National Digital Health Mission, which is popularly known as Ayushman Bharat Digital Mission. The budget remains almost same at rupees 200 crores. Now, the government has, of course, if you look at the allocation to the National Health Mission, which is about 36,000, I think the budget allocation for ICMR has been raised from 2,295 to 2,732 crores. And therefore, I think it also becomes important to see the other programs, particularly the National Tele-Mental Health Program, wherein the budget has increased from 65 crores to 90 crores. Now, when we look at the allocations of the autonomous bodies, which is pegged at about 18,000 crores for the autonomous bodies in general, we see that All India Institute for Medical Sciences, for instance, the budget allocation has increased, not very greatly, but marginally, from 4,278 crores to 4,523 crores. Therefore, I think the additional, exemptions from the drugs that the ministers talked about, particularly the cancer drugs and the related components of X-ray tubes and digital detectors, while they help those of us in need of cancer care, it's important to see these proposals which have been made vis-a-vis the budget, and how the WHO representative to India has made an observation on the budgetary allocation to the health sector. And that's where perhaps it becomes important to note that the significant boost in the fund allocation for health, including Ayush, in some ways underscores the government's commitment to health promotion, to disease elimination, and strengthening of public health care services, which is what the WHO representative makes an observation on the budget. Therefore, perhaps when we're looking at the additional custom duty exemptions from the three cancer treatment drugs, and also the life-saving, it's kind of impacting on the regime of life-saving drugs that are important, also making therefore the care affordable to certain level. There is a point to perhaps think in terms of the needs which the budget kind of requires to tilt itself towards what's happening to the more prevalent illnesses too. Because if you look at the 2022 projected numbers of new cancer cases in India, which peg themselves at 147, which perhaps calculates to a rough incident rate of 100.4 per 100,000 individuals, as compared to diarrhea, which is the third most common cause of death in under 5 children, and is responsible for 13% of death in this age group, killing almost 300,000 children in India every year. Also perhaps needs that kind of attention that the budgetary allocations require. I will pause here and move on to the other panelists. Thank you so much.
Well, IMPRI, do we have Urvashi ji here or no?
Not
Hello.
yet. We can go for discussion round.
Okay. Are there any questions from the audience or someone?
We can take if we get any.
Okay.
Madhuji has raised hand. Yes, ma'am.
Yes, Madhu ma'am, you can go ahead.
Yes, am I audible?
Yes, ma'am.
Okay, okay. Uh, I'm Madhu Sharma. I've worked in the health sector for nearly 18-20 years. And I'll just briefly share my observations. Much of it have been already shared by the esteemed panelist. And I congratulate IMPRI and Dr. Manorama for hosting this very useful panel discussion. And my brief observation, some of them are similar to what has been shared. I share the, echo the values of Dr. Abhijit that high dependence on the insurance model is not good for the country on the longer term. So whatever said and done, insurance sector is there for business purpose. And it will not improve the equity of the health sector response. So very much, I mean, the health, at least the primary and secondary health, should be the complete ownership by the government and not because insurance sectors also brings in the private sector dependence. And private sector, it just, it only caters to the creamy layer. It does not provide services for the middle income or the lowest cadre. And so it increases inequity in a way. And also, it is a government's tendency to, sort of through the Ayushman Bharat, sort of off-shouldering your responsibility or outsourcing the responsibility. And we've seen the results of outsourcing in the NEET exam, because education sector did the outsourcing and we're facing this. So, I mean, you should be able to take ownership for the and responsibility and accountability, because private sector will take responsibility but not accountability. So that's just one this thing. Then also the gender perspective. From the gender perspective, I say things are not very rosy, because when inequity increases, it's women and children who are most deprived. It may be for the other marginalized groups, such as tribal people, such as migrants, or elderly people, senior citizens. But anyhow, that inequity always increases. As we see in HIV sector, in 2002, only 25% of women were total HIV PL were women. Now they are 44% of total PL HIV are women. Because somehow, I mean, whatever the progress HIV sector has made, women are not getting the appropriate response. And we are far away, even, eliminating mother to child transmission of HIV, we are not nearby. I mean, smaller countries, poorer countries have achieved 100% coverage of EMPTC, prevention of parent to child transmission of HIV, but we are not. We still have a 25% rate in that regard. And yes, social determinants. And also we've talked, I think ma'am talked about nutrition a lot. Yes, there is definitely a lot of interest in addressing nutrition as in social determinants, but micronutrient deficiency per se as sub part of that needs to be focused more, I suppose. I mean, it's not sort of lack of food which is causing problem, but inappropriate, wrong food which is causing more problem. So that also need to be integrated in your education side, health education part, or awareness or training in this thing. And the other sector, which I also think was somewhat not neglected, is more neglected, and is non-communicable diseases, so-called lifestyle diseases, which are going to increase hugely in coming years. And they're not properly addressed. And that's a matter of concern. Of course, the earlier panelists have shared that increase in amount is negligible, or even negative if I say the increase in amount just goes into the salaries of personnel. So actual increase is not even there. And I mean, there's a lot to be improved in terms of diagnostic facilities at the health and wellness centers. At least there you can catch the disease at the initial stage and diagnose the thing so that they can be treatable. But even though in words and in guidelines, there are so much of awareness, or the guidelines say that they are supposed to have so much diagnostic facilities, but on ground, there is not much visible. That is something, at least right diagnosed at the right time is equals to half treatment. But if we are not able to do that, that's also seriously a matter of concern. And last point will be, I'll talk about, because the digital mission we've shared, not much increase, but there is a demand. We've seen how malware, handicapped or criminalized aims in Delhi. And if all 23 aims, I mean, if our aims of Delhi doesn't have this facility to stop malware function, forget about all other aims. They are not also functioning to their full capacities. So there is a lot of scope in terms of improving, the technical part of digital mission and cyber security in the health sector also. We don't know if people sitting in outside India might use our health sector as a terrorist infringement also. We don't know, because even terrorism nowadays is outsourced as a service. So your health sector needs to be very capable of it. Improving health resilience to disaster risk or health emergencies needs to be improved. Somebody, those antisocial elements might think of, say water resources or water bodies can be contaminated to, result in large scale disease. So there needs to be prevention and measures for all those things, I suppose. I think I'll stop here. I could go on, but that's all, I think.
Thank you, Mamta ji. Is there anyone else, Tanu, with some comments?
Thank you so much, Mamta. Madhu ma'am. Sorry. Madhu ma'am, thank you so much for joining us today. Abhijit sir, I have one question that you said that you find the health insurance model of India a little bit flawed. So can you please elaborate in a few lines?
Yeah. The point is very simple. I think Madhu covered that point. The essentially the basic point she in fact began with, when she was intervening, whatever she had to say. My point is that, anyway, let me put it this way, because many economists, let me not take any name, because, once I say a name, then of course, some amount of bias, some amount of prejudices will come in, and then they will say, oh, this fellow, or all these old lady, or this old, professor, he or she will say the same thing. But I am not going there. But, it's a general viewpoint. I am saying that there is a general viewpoint. There is one school of thought who actually says that you can't forget about all other things. I am an economist. Let me talk about the GDP point of view. Even if you want to increase the GDP, I have a problem with that approach also. But anyway, let me not deviate too much. But, if we take the GDP approach, whatever is the dominant approach, whatever the government actually goes with, that we are going into that much trillion, this much trillion, but, whatever, how will that GDP be attained, first of all? Because, that the way that people say, in Delhi, people say, aisa din nahi rahega, or something like that. So obviously, you cannot keep on growing like that year after year after year. The biggest example is China. They were doing it. They actually did it for the longest possible time, almost for 2.5 decades they did. Out of that, almost, close to 16, 17 years, they actually grew in double digit. But to, even having that kind of a growth consistently for year after year after year, what you need is that you need a skilled and also a healthy population. Why healthy population? Because this point is not enough elaborated. Why healthy population? Healthy population because of productivity. It is, to put it very simply, the point is that if I am not well, I am a sick worker, then I will go to my workplace, whether I go to work in factory or, do physical job, or whether I do a mental job, whatever, what we are doing now, that, the entire white collar kind of a sitting on a chair, or that kind of a job. But if I am not well, my productivity is bound to get affected. So obviously, and if there are more and more people like me, in the labor force, then how would the productivity rise? And if your productivity does not rise, your GDP will never rise. So that is why, forget about other things. Most of the time people say from a very moral point of view, no, these people, there is this population, this section of the society, they are poor, they are middle class, or they are lower middle class. They need to have some health facilities, and so on. But I am not getting there also. Those are actually very, very moral, and I am not saying that those are wrong. I am saying those are also right. But even if you see it from a very, very narrow economic point of view also, you need a healthy workforce, to get up into the ladder. So once you want to get up into the ladder, so obviously then you need to have some amount of expenditure. That is what I was saying. And I didn't quote the UK, that entire UK has, why I am taking the example of UK? I am taking example of UK because it has got a public funded, still, it has got a public funded and reasonably well maintained and reasonably well functioning National Health Service. And I know from friends and acquaintances, and some of, one of my relatives are also there. Some of my relatives are also there. So they in fact say that it takes care of everything. And how much do they spend? I was talking about in terms of GDP. Forget about pandemic. In pandemic time, it actually went up in double digit of GDP. Remember, where actually we spend somewhere around 3 point something of GDP on health expenditure. They in fact, even before pandemic, normal time, throughout the decade, I saw it was just a little bit below 10, but 9.8, 9.9 consistently they are spending. So that is the kind of model I would say that universality of that model in fact covers the entire population. Then immediately people will start saying that those who can pay, why can't they pay? That then, somebody was mentioning that entire primary, secondary and tertiary. My point is very simple, that, if you cover the primary and secondary enough, your job is almost done. Tertiary people will pay. Of course, there is some cutting edge, there is some kind of a health facility that somebody wants to avail of. Then of course, that can be done. That can be done through the private channel, or at least part of it should be through the private channel. But the basic healthcare, and once again, that Dr. Manorama mentioned that not only the doctors or the hospital where actually you go and you show that, I am sick, I have to take this, but even medicine also, that medicine and other kind of things. Those things are also necessary. Then, of course, these are the things. And then insurance, of course, it's a very common knowledge that once I go into, and now we are seeing in anybody, God forbid, I hope that none of us and none of the person I know that, fall very sick, so much sick that, they have to get hospitalized. But whenever that kind of a situation arises, we always go and see. It is all about your how much cover do you have. if you have, I have seen that in front of my eyes. I'm giving an anecdotal kind of evidence, but I think this kind of anecdotal evidence, everybody will have at least one or two or three personal stories like this. That if your cover is 2 lakh, they will try to, go up till 2 lakh. If your cover is 5 lakh, they will try to go up to 5 lakh. If your cover is 10, and it goes on like this. So then that is the real problem, because what you are doing essentially, and then the major problem with this entire Ayushman insurance, from the government, central government side, is that basically you are subsidizing all those private sector insurance firms. In a way, if you think it a little bit deeply, then you will see that basically all the money are going through public money. These are all public money, all kinds of taxes, direct and indirect taxes. They are collecting from the general population, and then those money, part of those money are actually going into the insurance firms. Why? You spend that exactly. I am saying that, don't spend more. Whatever you are giving into that Ayushman thing, why don't you directly say that I am trying to build up, health centers, rural health centers. Do it for, let's do it for 150 and 200 every year. How does it matter? In 5 years or 10 years time, that will cover almost 70-80% of the country of rural India. I'm pretty sure about it. And why you are giving money, keep on giving money to all these private insurance, and then it's a maze of, and then people will say that no, these things can be taken care of. You need a regulator, but we have IRDAI. So then what are they doing? They can't do anything. Beyond a certain point of time, if the regulator does not have any teeth, they can't implement anything. So my point is that from the GDP point of view, you need a healthy population, healthy workforce. And if you need a healthy workforce, you have to spend money on basic healthcare. Forget about other things. Let us first talk about basic healthcare. Basic healthcare, and as Dr. Manorama said, that also free medicine, to certain extent. Of course, you have to put certain limits or whatever, that I understand. But let us do that. Let us try to do that. We are not spending less amount of money. From the time of inception of this Ayushman Bharat, let us, add up all those money. It will not be a very meager amount. It will be substantial kind of amount. We could have, built I'm not saying, if you start saying all these things, they will say that no, if you have to build one, don't build AIMS everywhere. Build health centers. Build small health centers, even in urban areas, in the semi-urban areas, urban areas, not so big cities, tier 1, tier 2 cities. Do that first. I think that will have a transformative effect on the entire public health sphere. I have a very strong belief on that, but I don't know. But anyway, I am in the policy making circle. I am in a minority, so I can't say anything beyond.
That's a very valid point, sir. Do you have any estimate as to how much will it the outlay would be? Because for Ayushman Bharat, we are giving to our poor population. If we extend it to our non-poor population, do you have any estimate or anything? So that state governments can also maybe they can also take up for universal healthcare. We did a project for SSR.
Absolutely, I agree. But offhand, I will not have any figure, that way. But then one can make an exercise, a very ballpark kind of an exercise that can be done. I agree with you that, we can actually look at the ballpark exercises and then see that how much money from the central and state governments are till now. I am saying cumulative. I am not saying that, this year, that year. I am saying cumulative. My own belief is that, my own hunch is that will be a very big, substantial amount, if not big, if not very large, but it will be a substantial amount. Why can't we make smaller health centers particularly in rural areas, but also in those areas of, cities and all tier cities. Even in Delhi, there are JJ clusters. Why can't we, Delhi, at least, the state government has some mohalla clinic and other kind of a thing. people may come up with some criticism of that also, but that is fine. But for me, something is better than nothing. I would say that why can't we extend it to Mumbai or say Kolkata or and Chennai, or in other, why only these 4 metropolitan cities? In other cities also, why can't it be there in Patna? Why can't it be there in Sonipat? Why, all these places also one can build up, and it will not take much money. That is what my whole point is. Even if you give 50 lakh of rupees, you can make one small health center kind of a thing operational in a smaller city or definitely in a village. Definitely in a village, it will take even less, maybe even half of that. Let us begin with that. Why not?
Shobaji, have you seen any of such exercises being done for India? I visited Maldives for a health study funded by SSRC. There, they are having universal health coverage. Of course, the private sector is also there. Even Tata Hospital is there, the biggest cancer hospital. They are also coming. Manorama has done extensive study on medical tourism as well. So they are coming for super specialized services, but the health insurance there is universal. So are we moving in that direction? Or maybe for non-poor, we can give
Yes. Please don't get me wrong. I am not saying that, I am not talking about barring private sector from the healthcare. Let all those cutting edge people, let all those people, who can pay, go to those places and then actually demand. And then you have in all those cases, you should have a very strong consumer right kind of a infrastructure also. Because so that, if somebody is going and paying, let's say, for some ailment, getting hospitalized and spending over a period of 15 days or something like that, spending 10 lakh or 15 lakh or something like that. So there should be some yardsticks by which actually you can measure all those, I would say that, that entire customer satisfaction kind of a thing. That is what I'm trying to talk about. So don't get me wrong. I am not saying that, you just move aside the private players. But what will happen, my idea is that if you have a basic healthcare available from the government side, all the, those, let me use the strong words, all those fraudster and, all those scamster in the healthcare sector, they will disappear. I am saying that they will disappear within a period of 5 years. And only those private players, those who are actually competent, they are competent in providing some cutting edge tertiary, health services, they will remain. They will remain, or even secondary services, of course, and why not? We don't know, because, we have a population where actually somewhere around possibly, 10% of the population, they possibly have the capacity and the willingness to pay also for even basic health services at the private sector. Let them pay. I am not saying that, if somebody wants to get into a very kind of a hotel kind of an experience in a hospital, in a private hospital, let her or him have it. I don't have any problem. If the customer does not have any problem in paying, then let them have it. But my problem is that the 80% of your population, probably even more than that, they don't have the capacity to, pay for even the basic healthcare. If there is some complicated disease which actually has happened, and in any family, the out-of-pocket health expenditure actually, kills the entire family's savings and other kind of things. That is the kind of situation we are having. And to address all those problems, I think, as you correctly said, that an universal basic healthcare is very, very much necessary. That is my belief.
Shobaji, do you want to add anything?
Yeah, I mean, a lot of discussion has happened. I think we do have programs. Everybody is trying to emphasize on the same thing. Like we do have biggest, largest program drive, like, immunization, nothing like what India has. And even during the COVID, we have seen that the biggest vaccination drive we did. I think the whole idea is to prioritize expanding and upgrading the existing health infrastructure. and it's kind of more of investing in the primary and the secondary public health care. Even Abhijit talked about the out-of-pocket expenditure. I think there is a need to expand on the primary and at the village level, at the district level, at the village level, small units of primary health care where you could at least get preventive and curative, facilities, which will kind of reduce the out-of-pocket expenditure. We do have schemes like Ayushman Bharat, and I think Manorama ma'am also mentioned about the inclusion of elderly. I mean, I've also seen in the interim budget there was an inclusion of Ashas and Anganwadi workers in the Ayushman Bharat program. So I think the need for expansion to have more beneficiaries covered under the health coverage would go a long run. It'll have a very positive impact in the long run. Plus, yes, definitely, all this can be impacted by promoting more of telemedicine and digital healthcare, which will make it all the more accessible. And because availability and accessibility and the cost is a very big issue, especially for the marginalized communities or the rural areas. So I think to more investment and more expansion in terms of promoting telemedicines and digital healthcare, and at the same time creating awareness for people to understand how these programs can be utilized for their good. I think all this put together, the union budget has kind of prioritized a few of the things, but we require a big whole umbrella of the programs to come together, to merge together, and not to work in silos. But I think this is a time we need to think, we need to ponder, and we need to see where the investment can rightly be impacted for the whole population. So that's what I would like to summarize from all the discussion.
Yes, Madhu ma'am, you want to ask something?
Not ask. I think the time is over. I can just add on to your earlier observation about, health and economy, how they are related. Our ancestors said health is wealth. And why did they say it? One was because improvement of productivity, Dr. Abhijit sir has mentioned. Then the second relation is health sector itself is an employment possibility. So it is an economic sector as an employment this thing. Then as a user, you spend money on health diseases in this thing. So that's the third angle of the health and economy this thing. I just wanted to add. And about the insurance sector that you'd asked, I must say I'm not against the insurance, or at least the private sector, because without private sector, any government, not even just say India or even UK, they have private sector playing their role. But insurance sector, when it gets in an additional dot in the circle to commemorate. So when you are in the hospital trying to find doctors and all, then you have to connect the insurance person, whether that is covered, how much time will you take the money to come. And insurance sector will find 101 ways to delay or deny the coverage some way. I mean, if you're not tech savvy or a smart person. Or it can also lead to malified practices. In Arogya Shri in Andhra Pradesh, because uterus removal was covered, so great portion of uterus removal was done for women who may not have required the same. So such things can also occur. So one has to be cautious about it. And that's it. I think time is over, so I will not take much time. Another thing I wanted to say, small things like hemophilia or thalassemia, at least they are genetic and they should be covered 100% for every person. That's it.
Okay, thank you so much, ma'am. Now I'll ask one last question to Shobha, ma'am. So, ma'am, in the recent National Family Health Survey, which is the fifth one, we saw that the proportion of anemia in women is like 50%, both in teenage women as well as the pregnant women. So I know there are various interventions being taken, like the government is, distributing iron supplements, and there's one new concept of bio food fortification also. But there are less evaluation and impact assessment studies on this. So, like, what do you think in such cases of malnutrition and micronutrient deficiency? Should the government focus on mindlessly spreading the nutrient supplements in the population, or can there be any other good intervention on this? Like, how can we increase the micronutrient, both the detection also, if there's one the deficiency? So how can we detect also, and once it gets detected, how can we cure it? Instead of spreading it, distributing the supplements mindlessly.
Yeah, I think this is where we need to have convergence between the ministries. I mean, this is a subject which is both related to health as well as nutrition in women. And this is one which causes the vicious cycle of malnutrition. I mean, one might think, well, how an anemia can cause a vicious cycle of malnutrition. I mean, anemic women giving birth to a low birth weight baby, that turning into a stunted child, and then, getting into a pregnancy at a with a very low BMI, and then a malnutrition occurs. So I think it is at both ends. Not only that, even if you see the NFHS survey, it shows that the iron supplementation, the IFA tablets, which are supposed to be consumed for 180 days or at least a minimum of 100 days, that is there. But that is provided. What it says is how many percentage of women were provided with IFA tablets. It doesn't say how many percentage of women consumed it. You can't have 70-80% of women taking it and the same percentage consuming it. So I think it is a convergence aspect, and that is where we are also trying to look at the take home rations as well as the supplementary nutrition being provided to pregnant and lactating women, that has the criteria of micronutrient rich ingredients being added. If they add sattu, if they add chana, if they add green leafy vegetables, that is where they try to bring about indicating how anemia, how iron rich food supplements could be added to your diet, to the food pot, so that at least the whole family can benefit. And not only the women, but the children as well as the whole family. So I think there is a need for convergence to see here between health. Under the portion 2.0, there is a convergence happening, but how much is implemented? I mean, the results show, you can see, just to give an example of working in silos, the early initiation of breastfeeding is at the Ministry of Health. But when it talks about exclusive breastfeeding, it goes over to the community, which is taken over by the WCD. So when 80% of institutional births are happening, but the early initiation of breastfeeding is 40%. Why? Why only half of early initiation is happening when 80% of births are taking place in the institution? So that's the same question. How much a program is being implemented? And for the anemia, there is a 6x6 strategy. And one very important part of the strategy is awareness generation and behavior change. So I think one needs to counsel, one needs to, whenever they go to the primary health center, whenever they're having the ANCs, I think other than giving the tablets, counseling is very important to create that awareness in the women, that how an anemic women, what could be the impact on your offspring. So, and also further taking it down to the community, where the Anganwadi worker can do some demonstrations of how iron rich foods can be incorporated in the diet. So I think it's a culmination of both ministries, both workers putting in efforts to see that the women is aware how iron levels could be improved and how anemia could be, and it's not only in children, it's not only in women, it's also high in children. I mean, around 67%. I mean, that's a high number. So I think there is a need for more awareness generation, more of counseling, to make the women understand what is good and what is bad and how things could be improved. So that's my observation and suggestion, for this.
Yeah, thank you so much, ma'am. Let's move ahead now.
So, is there any other comment somebody would like to talk about? Maybe probably like One Health was something I was expecting, because One Health was for that lot of like post-COVID, lot of funds were given to One Health, but it has not really taken off. Like we have been talking a lot about the surveillance, and surveillance also is something that needs to be addressed, but that also has not taken off. And Tanu, in case like I'll be now sharing my closing remarks. I first of all thank all the panelists and as well as the participants, Madhuji, for their invaluable insights and contribution towards today's discussion on Union Health Budget 24-25. Even though this budget has made some significant strides in cancer care, or maybe to some extent in RCH component by keeping enhancement of some component there, almost 4,000 crore rupees in that component. But significant areas need attention, and especially when we talk about the health infrastructure development. When we want to reach the last mile, when we want to look into the affordable, accessible, quality healthcare, we need to have the awareness generation, the way Dr. Shoba ji has mentioned about, like simple concerns about the early initiation of the breastfeeding or giving your child exclusive breastfeed, and then when to enhance and put in like, complementary feeding in a child. I think these are some things which awareness needs to be generated across the communities, across the societies. Some of the things that we address here, I'm highlighting, I just noted down some of the points which actually all the panelists, Abhijit ji, Shoba ji, and Panda ji has mentioned. One thing that also, and in fact, Sanghmitra ji's video also addressed it, insufficient allocation to health sector. Vis-a-vis, like when we further looked at the inflation and then we looked at the budget that has been allocated, so there has not been much. There has been extremely minuscule increase. So that is something that will. And when Sanghmitra ji told about the other departments and other ministries like defense, wherein significant funds have been provided, however, there has been insufficient allocation of the funds, especially when we are talking about reaching the last mile, having the Ayushman Mandirs and health and wellness centers, looking into the infrastructure development, having the Ayushman digital platforms. So what are we doing on those aspects? I think that also needs to be addressed. Something having just rupees 3,000 crores for health research and innovation, that is extremely low, which I feel the budget should have considered that. Looking at the countries like China and other developed countries, they keep at least 20% of their health budget on these kind of research. That's how the China year after year has actually putting a lot of patents in a health segment. So I think that that also needs to be looked into. Probably like we all healthcare professionals need to raise these issues, like health research and innovation is another segment. When it comes to the health system strengthening, while the measures have been there when it comes to the treatment costs, but somehow not much of the expenses have been incurred about the preventive care. I think the budget also does not mention about or above all about the increase in healthcare coverage, quality care, how they are going to address the universal health coverage. That also has not been addressed thoroughly. I think that when it comes to the Ayushman Bharat PMJAY, something I mean, what we are saying that almost like 40 crore people are availing it. I think still there is a lot of improvement, which Abhijit ji also mentioned about. Like something we need to look into the Ayushman Bharat package being extended to the elderly care. That's one thing I would like to talk about. And extending the outpatient care, especially, which is not there as of now in Ayushman Bharat, especially for the OPDs. So that can also should be there. Then we can talk about the chronic diseases, even though we are talking about spoken about the cancer, and their budgets have been outlaid for that. But somehow diabetes, hypertension, that needs some attention. Public surveillance, especially like when it comes to the pandemic prevention, preparedness, and response. And then tuberculosis, something, even though like we had the TB Mukt Bharat by 2025 agenda, but still like we are lagging behind on that front. And Delhi is the state wherein the TB has been increased. So that is something we have to look into. Like when WHO has already mentioned about the next generation sequencing, that is something we can look into the MDTB, that is multi-drug resistant TB. So why not have these kind of, diagnostics for multi-drug resistant TB, so that we can very easily reduce the time of, detection, and we can give the treatment to the patient. That is something I think that the government should look into these kind of things. And One Health is something, because post-COVID, everyone was talking about the One Health, and a lot of funds were allocated for this, because it is where the interconnectedness between the human health, animal health, environment, ecosystem, our oceans, oceanography, and how it can actually how it can spill over from humans to, like we have seen the bovine TB. Bovine TB is going from animals to humans to animals, like in the buffalo. So how that is happening, and from so much of zoonotics happening from animals to humans. So that's another thing I would like to talk about, that this health budget should have addressed this. Then innovation in medical technology, even though like the budget is talking about this angel scheme, but then still maybe something to do with GST, maybe how we can look into that, how we can sort of emphasize the need of innovation in the medical technology, so that more innovators, more Atmanirbhar people, those who want to invest in medical devices, can come up. Then something to do with medical value tourism. If we have to get the foreign direct investments, if we have to get into the public-private partnerships, I don't think much has been done about the public-private partnership. One of the Niti Aayog report only has shown that only in road and transport, something of 40 to 50% is going into PPP, but in healthcare industry, it is just lagging around 4 to 5% in public-private partnership. So that is a big potential wherein we can get, engaged. Then when there are a couple of things that we need to address, like NRHM is okay there. We need to strengthen our NRHM. But what we say NHM comprised of NRHM and NUHM. NUHM has not really taken off, just lagging around 1,000 crore rupees, the budget for NUHM. So that also needs to be looked into. So as I conclude, I think it's very evident that the budget represents overall, like, has addressed some of the key health challenges, but still some of the critical, areas in the healthcare needs some kind of attention. The industry was looking forward for, especially the medical device industry was looking forward for more friendly policy or schemes. I think that also needs to be addressed. Looking ahead, we can advocate for the policies that not only sustain the momentum of today's initiatives, but definitely will foster innovation, harness the potential for the budgetary provisions for a robust, equitable healthcare. I once again thank each and every participant panelist. I had esteemed panelists with me. Thank you so much. Mr. Panda is not here. Definitely thanks to Mr. Panda, Mr. Abhijit, Shoba ji, Madhuji, and Sanghmitra ji also, who has shared her video with us. Over to you, Tanu.
Yeah, ma'am, one last question that you mentioned about One Health. So India, we have high population density, we have second largest livestock, and we have high usage of over-the-counter medicines. So we have this rising issue of antimicrobial resistance. So, but there was one policy named as National One Health Mission, and it was there to they are collaborating too many ministries, and they are like working towards tackling like preparing for the future pandemics which will be there. But hardly there's any mention about surveillance and how this is going to be executed at the ground level and how they are going to allocate the funds in that. So, would you like to say anything about One Health and surveillance? Because there's like very blurred mention about all these things on the internet right now.
You are absolutely right, Tanu. It is something that we all have to look into and ponder about, especially like knowing that a lot of ministries are involved in it. We have the National Security Agency, NSA is involved there. Then we have the Ministry of Environment is involved. Then we have the Ministry of Health as the nodal ministry for it. We have, almost every fisheries, Department of Fisheries is there. Department of National Oceanography has to be there. Department of Cultural, Ministry of Culture has to be there. Then Anthropological Society of India has to be there. Department of Biotechnology has to be there. But unfortunately, having so many ministries around, and we had emphasized that there will be a robust plan around the One Health. In fact, I have been told that there was some kind of meeting going on yesterday at Niti Aayog, when some external people had come up to discuss like about the AMR only. You raised this very important question. Like today, if we see that antibiotics are not working now on the humans, so antibiotic resistance, because not only this, the antibiotic resistance has impacted so much, not only humans, but also the chickens and other people. I mean, I'm giving you the example, like when I was into Ministry of Health and I was in 2017, I was monitoring in some segments of Jammu and Kashmir. I met a lady and I told her, what are you doing? What are you giving the chickens? Because she added the chicken food and added some water, mixed something in it and gave it to chickens. I said, what did you add to it? She said, antibiotic bacha tha, thoda bahut after giving the kids, I give it to the chickens so that chicken can be healthy and I can have good poultry and good eggs and all that, and they don't fall sick. Now the question is, from chicken, it reaches out to us and we are getting the antibiotics and on the counter also medications we are having. So AMR is something that the ministry was looking into, but somehow what is happening in that domain? What are the concrete policies? How we are going to have the surveillance system in place? Recently, Department of Biotechnology, Dr. Jitendra Singh came up with that India has produced 10,000, surveillance of our, different species, human species. But when India is such a robust country with almost like 4,500 hamare different human species varieties, and then almost a lakh of animals, different varieties, and then plants another 1 lakh. So with that kind of the whole genome, sequencing needs to be done. And then the cause of worry today, we see that a lot of these institutes were built post One Health initiative, like almost 50, 70 labs have been built by the Department of Biotechnology. But what is happening in these biotechnology labs? Nobody knows it. Equipments have been there, but surveillance is not happening. Just 10,000 surveillance sequencing of the people of India, जहाँ पे हम 1.4 billion population की बात करते हैं. When you look at Europe, in Europe you have something like 5 lakh of the genome sequencing they have done with such a small minuscule population, while India is grappling at 10,000 only. And second thing is something what we can talk about is land border clause. एक साइड से हम कहते हैं कि China is there something, China is interfering in our things, and on the other hand, like we are using the China platforms for our genome sequencing in these labs, CCMBs. So obviously, when our whole genetic data, our ecosystem data, our animals who are there, unka data, सब कुछ China के पास जाएगा, then what are we going to do with it? So these are some of the things that we have to look into. That's why I think that the more we can talk about the One Health things, the better it would be for us. All the departments, that's what Dr. Shoba also mentioned. Like when we talk about the nutrition, and Anganwadi center and the Asha and the those kind of things. उनमें इतना synergy करना just between the two departments मुश्किल है, and wherein you have almost 10-15 departments and ministries together, and they have to work synergistically and equally. So I think that we need to have strong systems therein. Some ministry has to take and lead it and lead it to some logical conclusion. Over to you, Tanu.
Just a small trivia, just to, in a lighter mode. I was just, just for the sake of it, I was just checking how many times health was mentioned in the budget speech. It was mentioned four times.
Yeah.
4 times, and that also in generic terms, not in a specific term. In a generic term, like, it came with like health, education, housing, etc. or something like that. So that
exactly.
Yeah.
When I gone through the report, I wanted that there should be something substantial, and I did Control F to find out health mein kya. It was a generic thing. Then I thought that, okay, let me look at the interim budget.
I can't believe
interim
it.
budget mein fir bhi better tha. In interim budget.
Yes. Interim budget was much better. Yeah. Interim budget was much better.
Over to you, Tanu. Thank you so much. Thanks, panelists. I don't know if Tanu is there.
Thank you so much. Thank you.
Yeah, thanks. Anyway, doesn't matter. So I am leaving because, I have to
I also
finish something. Yeah.
Sure.
So nice to see you, Shoba. Maybe I'll give you a call someday.
Yes.
And nice to know you, Dr. Manorama. Maybe
Arjun is there.
Yeah, we will meet someday.
Sure.
Yeah.
Thank you.
Thank you so much. Thanks.
Thanks, Arjun.
Thank you. Tanu, over to you. You can say bye, formal bye to everyone.
Vote of thanks, Tanu. Yeah, go ahead.
Yes, sir.
Go ahead.
Okay. So, as we come to the end of today's discussion, I, Tanu Paliwal, researcher at IMPRI, Impact and Policy Research Institute, would like to propose the formal vote of thanks on behalf of IMPRI, Center for Human Dignity and Development, IMPRI Web Policy Talk. I would like to thank all of you for attending today's deliberation, a panel discussion on population, health and union budget 2024 and 25. As a part of IMPRI 5th annual series of thematic deliberations and analysis of Union Budget 2024-25. We are grateful to our chair for the session, Dr. Manorama Bakshi ji. Also, we are grateful to our esteemed panelists, Professor Sanghmitra Acharya ji, Mr. Abhijit Mukhopadhyay ji, Ms. Urvashi Prasad ji, Dr. Shoba Suri ji, Professor Pradeep K. Panda ji, for taking out your time and participating in this discussion and enlightening us. We thank all of our participants who have raised pertinent questions and actively participated in today's deliberation. We are grateful if you're watching us later on our YouTube channel or listening to us on our various podcasts or reading our publications. We hope you continue to join in future to our IMPRI Web Policy Talk and Web Policy Learning. Wishing you all a very good day ahead. Thank you.
Yeah, thanks. Bye.
Yeah, thank you, sir. Thank you, ma'am.